Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola here with yet another Fast Facts Pharmacology Edition. Well, this one is all about respiratory pharmacology. And you know that there are two types of respiratory pathologies that we deal with when we talk about dental hygiene. One of them is asthma. And you know, asthma is a respiratory condition, but it's reversible airway obstruction, characterized by inflammation. There's usually a reduction in expiratory airflow, and it's typically precipitated by things like allergens, pollution, sometimes exercise, sometimes stress. Many times it's precipitated by upper respiratory infection and local anesthetics that contain sulfites, those antioxidants that preserve the epinephrine in those local anesthetic solutions. Well, what are the symptoms of asthma? Shortness of breath, wheezing. Hard to tell sometimes, but asthma at the end of the day, as we said, is a reduction in inspiratory airflow that's really based on inflammation. So if you can use an anti-inflammatory to treat asthma, it'd be maybe medications like Singulair and inhaled corticosteroids. The other respiratory pathology that occurs that is of concern in dental hygiene is, of course, chronic obstructive pulmonary disease, or COPD. Now, actually, COPD is two different diseases. It's emphysema and chronic bronchitis. Emphysema is characterized by alveolar destruction, or airspace enlargement, and basically airway collapse. Whereas chronic bronchitis is more chronic inflammation of the airway that results in excessive sputum production. Either way, the airway is obstructive, and it's not reversible, rather it's irreversible. Well, the treatment of respiratory pathologies really involves medications delivered directly to the lungs, and that includes metered dose inhalers. This is where the medication is directly delivered to the bronchioles. That means what? A lower overall dose, which means a lower overall adverse effect, and therefore more likely to cause good effects versus bad. You get a greater bronchodilating effect of a medication that's inhaled versus a bronchodilator that's swallowed. And more importantly, inhaled doses can be measured accurately, and they deliver a rapid or predictable onset of action. The disadvantages of metered dose inhalers include the fact that patients don't necessarily know how to use them properly. And so they're easily overused, which means that ultimately the patient becomes resistant to the effects, and that results in a diminished response. Also, children sometimes can't use metered dose inhalers because of their small airway, and sometimes need spacers or devices that actually increase the space between the inhaler and the child's airway. So what kind of medications can we use to treat asthma? Well, remember, it's the same medications that we use to treat COPD. They include short-acting beta-2 agonists, long-acting beta-2 agonists, as well as cholinergic antagonists like Spiriva, and finally, inhaled corticosteroids. So that will be the subject of our next episode of Fast Facts Pharmacology Edition, when we talk about the medications used to treat asthma and COPD, as well as the medication's side effects and their effect on dental hygiene treatment. So until then, my friends, thank you so much for joining me today. I'm Tom Viola with Pharmacology Declassified. Look forward to seeing you all again real soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Facts.